Hi, this video will address urinary tract infection in the elderly as part of week 4 in the NU 621 course, Advanced Pathophysiology. Urinary tract infection in the elderly is a significant problem. They don't present the same as younger adults, and the treatments are much more difficult. In the preparation of this video, I used these 4 references, and I have included them here as well as the websites from which you can access them. You'll notice that the Loeb and colleague article is from 2001. If you're going to use an article that is that old, it really needs to be a gold standard, or the article that and the research that everything else is based on. This is why I'm including it here. Otherwise, as you know, references should be no more than 5 years old. UTI in the elderly is found in all segments of the elderly population. When going through preparation for the video, I found that all of the researchers would segmentalize the elderly into the walking well, the chronically ill, the institutionalized elderly, because what they found was that each segment of this population has a unique set of characteristics and needs, and they present with different symptoms, and many times they are asymptomatic. It is a very common problem in the elderly. Matthews, Lancaster, and Israel found that UTI is the second most common infection in elderly women living in the community, but it is the #1 infection in the institutionalized elderly women. The general criteria for diagnosis of UTI are presented here. You can find these anywhere. I took these from the CDC. They're readily available. The most significant one in here is the last one, the change in mental status. This is seen very frequently in the elderly, rather than them being able to express that they are having pain while they urinate, or that they are having chills, or they have pain. So we got to keep this in mind about the change in mental status. The challenge in this population is that they present many times with significant bacteriuria, but they are asymptomatic. And I included the definition of bacteriuria in there. It's a great word to try to say. Numbers indicate that up to 30% of the elderly have asymptomatic bacteriuria, and it can be as high as 50% of the institutionalized elderly. So while they have significant infection, they don't realize they have it because they have no symptoms. In catheterized patients, it is nearly always asymptomatic. When you're dealing with signs and symptoms of a urinary tract infection in the elderly, it ranges the gamut. They can have the classic signs and symptoms, most often found in the independent elderly population, or, as mentioned previously, they can have the atypical presentation of increased lethargy, delirium, blunted fever response, anorexia. In our cardiology practice, we have the majority of our patients are elderly, and many of them come for their routine cardiology visits having been in the hospital for urinary tract infections. And the way that it was diagnosed was the family members will report that their loved one was not acting right, was confused, didn't respond, just sat there, cried. There's just a whole range of atypical symptoms. And the family didn't know what else to do, and so they took the loved one to the emergency room where the UTI was diagnosed. And what we find is that as soon as they are treated and the treatment starts to work, all these other atypical symptoms, such as delirium or confusion, go away. It's very remarkable if you've never experienced it or seen it. Speaking of treatment, in general, the treatment recommendations for the younger adult age groups are used in treatment of the elderly with UTI. However, special consideration has to be given to how severe the illness is, what are their living conditions, what are their existing comorbidities, are there other things that could be causing this that they can't use this specific treatment for, are there external devices in place, what is the pattern of local antibiotic resistance that would make use of a certain antibiotic ineffective in the elderly person in that area, or in the younger people for that matter. And of course the ability of the patient to comply with the therapy. If they can't take it in the form that we want to give it, it doesn't matter. Again, referring to Loeb and his colleagues in 2001, developed minimum criteria for the initiation of antibiotics for residents of long-term care facilities. This is a huge problem. Loeb and his colleagues took into account the difficulty in diagnosing UTI in the elderly in long-term care facilities, as well as the compliance success with therapy, and the threat of antibiotic resistance that would exist in that long-term care facility. This is such a significant problem that in 2013 the CDC published guidelines for the use of antibiotics in nursing homes, and I've included that reference and website for you. Our task as healthcare providers is to become familiar with the guidelines and recommendations for different segments of the elderly population who may be experiencing a UTI. This will help us be better diagnosticians, to look for significant atypical symptoms that may be presenting that would clue us into the presence of an asymptomatic UTI. Again, keeping in mind the difficulty with diagnosing the problem as well as the many considerations for timely appropriate treatment. Again, nobody memorizes these treatments, and they do tend to change over time with the significance of antibiotic resistance and, of course, newer drugs. Sometimes the newer drugs are not the answer, and the elderly respond better to the older medications, the generics. Please look through the references that I have provided. They're really very good. There are many, many, many references out there, so feel free, of course, to use one that you are comfortable with that gives you everything you need. Again, download it onto your tablet, onto your smartphone, because they, like I said, they change. The CDC will come out with updated recommendations soon, as the last update they provided was in November of 2013. So happy hunting for sources that are useful for you. And if you have questions, concerns, issues, email me or call me. Thanks for your attention.